Welcome to this section on general pathology with a focus on inflammation. In this self-directed learning video, we will explore the key mechanism behind hypersensitivity reactions, allergic disease, and autoimmune disorder. By the end, you will be able to explain this process in detail and recognize the significance in veterinary medicine. So let's dive into the world of chronic inflammation, autoimmune disease, and hypersensitivity reactions, learning how the body immune system can sometimes turn against itself. This lecture's video is one part of the overview of the general pathology. In inflammations, we are going to cover these two parts. For self-directed learning, we'll be focusing on the hypersensitivity mechanisms and allergic disease and autoimmune disease. An overview of the chronic inflammation. Chronic inflammation is categorized by a slow progression that persists beyond the usual 10 to 14 days of acute inflammation. And in some cases, it can last for many years. Unlike acute inflammation, it is not exudative, meaning it doesn't involve significant fluid leakage from blood vessels. Instead, tissue injury and repair occur simultaneously. This process leads to the formation of fibrous tissue and new blood vessels proliferation, making it a key factor in long-term disease. The major cells involved include macrophages, lymphocytes, and plasma cells, all contributing to the ongoing tissue damage and repair. One classic example of chronic inflammation is arteriosclerosis, which results from prolonged exposure to high level of toxic agents like elevated plasma lipids. The cause of chronic inflammations can result from various factors. Unresolved acute inflammation is one cause, where an initial inflammatory response does not subside or issue. Persistent infection, such as those caused by virus or bacteria that are hard to eliminate, can provoke chronic inflammation. Autoimmune disease are another cause where the body immune system mistakenly targets its own tissue. Prolonged exposure to toxic agents, such as in case of high cholesterol leading to arteriosclerosis, can also trigger a chronic inflammatory response from the onset. Hypersensitivity mechanisms and allergic disease. Hypersensitivity reactions often seen in allergic disease represent an exaggerated immune response to non-threatening stimuli. For instance, glomerulonephritis, a form of kidney inflammations, occur when immune complexes become trapped in the globuli, triggering the immune systems to attack this structure. If you doesn't know how does the glomeruli look like, it is good to refer to the anatomy of the kidney. This not only damages the glomeruli, but also thickens the basement membrane and stimulates cell proliferation. This condition can lead to chronic kidney disease if left untreated. Understand such hypersensitivity reaction is crucial in diagnosing and managing this disease. Glomerulonephritis is a condition often seen very common in dogs, when immune complex form in the glomeruli, which cause inflammation, leading in protein loss in the urine, which we call it proteinuria. This condition can arise due to infection or cancer, but sometimes the cause remains unidentified. Detecting protein in the dog urine is often the first clue. Treatment focuses on addressing any underlying causes, reduce the protein loss, managing kidney damage, and immunosuppressive drugs. Without timely intervention, the disease can cause chronic kidney failure. Let's talk about vasculitis. It's another immune-related disorder which involves in the inflammation of the blood vessels often seen in dogs. It can manifest as skin abnormalities such as purplish red spots or ulcer, particularly on the lower legs, paw, ears, and other areas. Drugs are a common cause of vasculitis, and the condition is diagnosed through biopsy of affected tissue. Treatment involves discontinuing the offending drugs or using immunosuppressive therapies to manage the conditions. This is a list of hypersensitive components in type 3, and on the left side is a list of organisms of the disease, and on the right side is the major lesion that you can find. This is a list for your reference. You do not need to memorize all of them. Let's talk a little bit deeper in the cellular level when chronic inflammation happens. Macrophages play a vital role in chronic inflammation. This cell originates from the blood monocyte, which migrate into tissue and transform into macrophages. Once activated, they grow in size, increase their phagocytic capacity, and secrete substances like cytokines that both promote inflammation and drive tissue repair through fibrosis. In chronic conditions, macrophages can fuse into larger multinucleated giant cells that contribute to sustained inflammatory response. Let's take a look at lymphocytes and plasma cells. The lymphocytes, particularly the T cells, interact with the macrophages in a bidirectional manner, promoting chronic inflammation. Macrophages present antigens to the T cells, activate them, while the T cell release cytokines and stimulate macrophages. The plasma cells that derive from the activated B cells produce antibodies that target persistent antigens. This immune interaction is crucial to sustain chronic inflammation, particularly in autoimmune disease where the body immune system attacks its own tissue. Let's take a look in another cell, eosinophils. These are key players in allergic reactions and parasitic infections. These cells are often found in inflammatory sites where parasites or allergens are present. Eosinophils release toxic granules that can attack pathogens, but also contribute to tissue damage in chronic allergic conditions, such as asthma. Let's take a look at the local effect of chronic inflammation. In chronic inflammation, mediators stimulate fibrous tissue formation at the site of inflammation and can cause hypertrophy and hyperplasia in surrounding tissues. For instance, in chronic skin inflammation, the skin can become thickened and greasy due to the hyperplasia of the skin glands. In the gut, chronic inflammation thickens the intestinal walls, impairing nutrient absorptions and lead to symptoms like diarrhea and weight loss. Granulomatous inflammation is a distinctive form of chronic inflammation. Here, the cells form granulomas, organized clusters of macrophages surrounded by lymphocytes and fibrous tissue. These structures develop when the cause of inflammation, such as tuberculosis bacteria or a foreign body like suture, resists destruction by normal immune process. A classic example is the granuloma formed in response to tuberculosis infection, where the macrophages fuse into multinucleated giant cell, or the MGC, at the center of granuloma. There's another instance whereby the neutrophils and the macrophages in the center of the granulomas, this we will call the feline infectious pancreatitis, the FIP. And the name of the complex cells is the myogranulomatous. Chronic inflammation, if left unchecked, can lead to long-term organ dysfunction. For example, chronic nephritis can cause persistent kidney damage, while chronic enteritis may result in weight loss and nutrient malabsorption. Systemic effects of chronic inflammation include anemia and prolonged fever due to continuous release of inflammatory mediators. This can significantly impact the overall health and quality of life of the affected animal. In this slide, I've shown you two tissue sections. The left one, the granulomatous tuberculosis TB, you take a look at the multinucleated giant cell where the arrow is pointing. The red outline means the peripheral rim of the lymphocyte enclosing the macrophages. On the right-hand side is the tuberculosis granuloma, where you can see multinucleated giant cells pointing at the arrow. Chronic inflammation often follows acute inflammation but does not always resolve as acute inflammation does. Depending on the cause and severity, the outcome can be healing through fibrosis or progression to chronic inflammation with persistent tissue injury and repair. This highlights the importance of early diagnosis and management to prevent long-term damage and dysfunction. We have come at the final chapters of this video, and it's time to show your understanding through reflection journal entry. So your self-directed activities comes here. There's 3 different veterinary cases presented to you that's related to chronic inflammation and autoimmune disease, which is being mentioned in the lecture in this video. A dog with chronic glomerulonephritis, a horse with vasculitis, and a cat diagnosed with FIP. Now you can choose one case study that resonates with you. You read through the case carefully on your own research and reflect how the disease mechanism is related to the chronic inflammation, hypersensitivity, or immune response that we have gone through in this video. You write a reflective journal entry for 500 to 600 words based on the prompts above. There is some guide for you. It's optional to how you can write your reflective journal entry. So first, to understand the case that you have chosen, what is the primary disease in this case, and what chronic inflammation is involved. in what way the body immune system can contribute to both the damage and healing process, and how you link theory to practice, which part of this topic 4.2 is more relevant in understanding this case, and how did the theoretical concept help you to understand what is happening to the animal's body. And lastly, do a short personal reactions about how did learning about this case affect your view on the impact of inflammation and immune disease in veterinary practices. Is there any surprising aspect of the case or concept that challenge your previous understanding? Do complete this SDR activity before coming to the week 13 lesson in the class. Let's recap the learning summary what we have gone through the video. In summary, chronic inflammation is a prolonged response that can last from weeks to years. It involves a delicate balance between tissue destructions and repair, and we covered the cellular level like macrophage, lymphocytes, plasma cell, they play key roles. While chronic inflammation can be a defensive mechanism against persistent infections or toxic agents, it also can cause harmful long-term effects, which include organ damage and systematic symptoms. Understanding the underlying mechanism helps us to diagnose and manage chronic inflammatory disease effectively.